So just to kind of give you a sense of what this is all for, that there's an evaluation called the CVI range, and the CVI range is a test that looks at the degree of effect of CVI. It's not just a yes or a no, you have it or you don't have it, but kind of what is that degree? And that's on a 0 to 10 scale. 0 is little or no visual functioning, and there may have even been a time when you thought she may have been more like that. And 10 means just like other children her age. And our job is to figure out where Holly's functional vision is and to assess that on a regular basis so that we can design her adaptations, her interventions to match that score. So the point of this is to really be able to figure out kind of where she is, to describe to you how she's using her vision now, and then to design interventions. In order to get that score, there are 3 things we have to do. One is to talk with you, to talk to someone who knows the child very, very well, and there's nobody like the parent, to watch her, and then to do some things face-to-face with her. So this first part is really that interview part where we can just gather some information by asking you some questions about various things, about how she uses her vision. So if you don't mind, I'd like to kind of go all the way back, and if you could tell me a little bit about her early history, like was she born full term or as a preemie?
She was 7 weeks early.
She was 7 weeks, so she was 33 weeks gestation. Okay. And did you know she was going to be early? I mean, how did,
No.
It was a surprise.
It was a surprise. I had, at 35 weeks, my water broke. And I was in the hospital because she was actually due the end of December.
I see.
So they wanted her to stay, as long as she could. But then I developed an infection which caused an emergency C-section.
Got it.
That's how she came early.
Okay. And you were in like a hospital, not a community hospital, but a hospital that would have a intensive care unit.
Right. Yeah, she spent 6 weeks in the NICU.
6 weeks. Okay.
And that was because of her low birth weight. She weighed 4 pounds when she was born.
4 pounds. Okay. All right. When she was in the intensive care unit, did she have to be intubated, or did she just breathe room air?
She breathed room air.
Good.
But she had IV feeding.
Okay. All right. And did she have any complications while she was in the NICU?
No.
Excellent. Excellent. Anything, did they do like head sonograms? Did they check her head for?
Not while she was there. No.
Okay. She have seizures in the newborn period?
No.
Good. Okay. All right. So then she went home.
She went home.
And what did they tell you when she went home? That everything should be A-okay?
Yeah, we knew with her being premature, just she would probably have some delays in her because her chronological age and her development. So, but she was not hitting the milestones at all. I mean, she wasn't rolling over. She couldn't sit up alone. She couldn't hold her head. She would always, her head would fall to one side.
Okay. So did she get early intervention then?
She was in a program till she was 3 years old.
Okay.
They started working with her when she was about 10 months. And some of the things that we worked on was like her hand and eye coordination, because when she would clap her hands, she would do this. She would want to stack blocks, like this being your base block. She would put it here.
Got it.
And then, like 3 blocks and she was done. She didn't want to do any more of it.
She didn't think that was so much fun.
No. And we worked on that for the longest time to get her to clap her hands and, just, hold both arms and put her hands together like this so she heard the noise. And
yes. Did you think there were any vision concerns at that point?
Knowing what I do now, I can remember sitting in my chair at her feeding times, and there was this portrait on the wall. Well, right beside my chair, I had a floor lamp, and she would just constantly gaze.
Okay.
And I'm thinking, she must really like this picture.
I see.
But I think she was looking at the lamp, because when I would switch arms to feed her on the other side, she would actually throw her head back so she could see that light.
Got it.
I don't think it was the picture. I think it was more that light, because she would go into different areas, different buildings, and that would be the first thing she would do, would be like go up to the light. And the mother in me is like, don't let her look at that. She knows that going to cause a seizure, because we were thinking focal seizures, because she would just look at that light and there'd be nothing else going on, but that stare.
Did she look at your face as a newborn?
She would look past you.
Okay.
I mean, she would like have her head this way, but her eyes would be gazed
I get it.
that way.
Okay.
So that's what brought the vision, why we thought she needed her vision checked.
Okay, so about how old was she when you decided to have her vision checked?
Probably a year and a half.
So you kind of lived with this concern for quite a while, and probably other people said, she'll be fine, she was early. Is that right?
Yeah, that
Did you
is
have those
developmental, she's just got to catch up and get, her hands and eye coordination together, and it just wasn't coming about.
So you took matters in your own hands.
Yeah, and she had her eyes turned in towards her nose.
Okay.
So when we went to get that examined, her doctor wanted to do an MRI just so he could get a better picture of what was going on in there and make his measurements for the surgery that we knew we were going to have.
To have her eyes straightened.
Right. And when we got the results from the MRI back, there was some gray spots on her brain, which turned out to be the leukocyte malacia, which...
PVL.
Yeah.
Periventricular leukomalacia, is that right?
Which she has.
Okay. All right. And that must have been a big surprise or shock or something.
Yeah.
How was that for you?
Well, I knew there was some issues, but like you've got therapists coming in the house saying, this is all, and then you're just there's something really else wrong here.
Yes.
And yeah, it was quite some news to take.
Oh, I imagine.
Because not only was she early and have to go through all this, but are we pushing? Where do we go from here?
Right. Was she walking at that point?
No.
Okay.
She was actually 3+ before she started walking.
Okay.
She commander crawled, or she would lay flat on her back and push herself with her heels.
She would, yeah. Okay. So she was a scooter. She liked to scoot.
Yeah, she did quite a bit.
Okay.
And she would stand for a few minutes. I know the first time I saw her walk, I was standing on my kitchen table dusting this loft area that we had above. I went around the kitchen shelving, loft shelving, whatever. And I had wine glasses in my hand, and here she come across the floor. And I'm like trembling because I've never seen her walk. I mean, she just took it upon herself and just started walking across the floor. And I got these glasses in my hand, and I'm on the table, and I'm like, oh.
Yeah, that's good. That's very good. And now she's totally ambulatory. I mean,
yeah, she uses a sight cane.
Oh, she does. So if she's using a cane, and she uses a cane like when she's in new places.
Definitely.
I'm going to. Well, maybe you can just tell me why you think they gave her a cane. What vision issues did they recognize that
she has to be verbally prompted? Holly, stop, end of sidewalk. We're going concrete to gravel. If you're stepping from the pavement to the grass, because she doesn't have depth. It's like if you tell her stop the end of the curb,
Mhm.
she can feel and step down.
Got it.
Or if we're going up steps, I will say, Holly, there's 5 steps here.
Mhm.
Start with 1
Mhm.
at the top, go to 5. We're at the top.
Got it.
So just verbal things like that.
Okay. She seems like she can't necessarily see things down below her knees
No.
and things. Okay.
No.
All right. Well, we'll get to that in a minute. So, how did the diagnosis, or what diagnosis did the doctor come up with after the MRI besides the PVL in the brain? What vision diagnoses did the doctor come up with?
We went from that. We seen a neurologist, and she diagnosed her with the cerebral palsy because of the CV.
Yeah, PVL.
PVL.
Yes, got it. Yeah, the
Big
words
words,
are
yeah.
crazy, aren't they?
I know it when I see it, but
I
it's
know.
saying it all.
I would only know it. I only know it because I work in a hospital
Right.
setting. So believe me, don't ask me to spell it. That's for sure. Except the PVL part. So after you saw the eye doctor, you saw a neurologist who diagnosed cerebral palsy.
Right.
And is it her lower extremities? Are they tight, or can you describe her cerebral palsy?
She has, in her lower extremities and spastic.
Okay. And that would probably be spastic diplegia. Yeah,
right.
Yeah.
Right.
All right. So let's get back to the vision part. So, or do you want anything more about the neurologist? What else did the neurologist have to say? Anything about the vision? Did the neurologist address the vision issue?
She agreed that Holly, because at this time, she could talk fine. We had no, speech problems ever with all of her other therapies that she's had. She's always been able to talk very well. So she said, anything she can do verbal versus written or on paper, let her say it. That was the best advice that the neurologist gave me about it.
And she's 3 years old at this time, right?
Yeah.
Okay.
Yeah, because she was going to enter into preschool. And the doctor, when they did the eye exam at that age, they had, the white cards with the black outline of the house, the apple, and
this is the eye doctor.
Yeah.
Right?
He would give Holly the card, and she would have to hold up what she was seeing on the bottom.
Match. Right. Got it.
And we would notice, she would turn her head all the way to the left, and she would look like this, which concerning. And he explained, the more she can turn her head, her eyes aren't jumping as much. She gets a better vision.
Okay, and that was because of the nystagmus that he also diagnosed? Right. All right. And so he diagnosed her with nystagmus. Let's get all these down. Nystagmus with strabismus, the eyes turning in, correct?
Right.
And then anything else he diagnosed her with? He also diagnosed her with?
The CVI.
Okay. And those were all at the same time?
Mm-hmm.
All right. And everything else about her eye exam, her retina and everything was normal?
Her retina looks good. Her father actually has retinitis pigmentosa.
Mm-hmm.
So we did check for that. And they did a retina exam on her. And it was fine.
Okay, good. And all right.
So then when she started preschool, one of the things that her preschool teacher or the people that was there doing the testing couldn't understand, we had pictures of a cup, a dog, and a bowl. And she would look at the pictures and would say, okay, where's the dog? Nothing. Holly, hand me the dog. She could reach the object of the stuffed dog there.
Interesting.
But to see it on paper, could not do it. She was in the preschool, and I was telling her teacher about this, and I was like, because she went to early preschool so she could get more therapy, and I was like, have you ever seen this? You give her this book. I know she knows what an apple is, what a dog is. But when you turned it to that page in the book, she couldn't tell you what it was.
So, how after the doctor diagnosed the CVI, what did you think it was? How did you leave that exam understanding your daughter's vision issue? Not the part about the eyes turning in or the nystagmus. What did you think CVI actually was?
I was learning about, I knew she had good cognitive skills,
Uh-huh.
and that's where I was. I was like, okay, we need to learn out what this CVI is, because I know somewhere between what she's saying and what she thinks she sees,
Mm-hmm.
or how she's interpreting what she sees,
Mm-hmm.
is not coming out right.
Mm-hmm.
Like if you would show her an ad in the paper to where a kid's standing, in front of a shelf full of dolls, she would say something totally off
Mm-hmm.
of what it actually was.
Mm-hmm. What would happen if you
Yeah.
just gave her $1 at a time?
She knew a doll,
Mm-hmm.
but if you set that doll, like in a pile of balloons,
Okay.
like anytime there's a lot of background going on, she has a harder time picking out an object.
Okay. Did she have a teacher of the visually impaired once that diagnosis of CVI was given? Did she start getting vision services?
Because she was more occupational, was working with her then.
Okay. All right. Does she have vision services now?
Yes, she has vision and mobility.
Okay. All right. So I'm going to just, I know it was a long time ago, but can you remember how the doctor described CVI to you?
You see through your eyes, and her ventricles, we'll call them passageways, are narrow in the back. So what he told me was by the time it gets back there and then transmitted out, it loses what she's actually saying.
Okay. All right. Very good. All right. So anything else about her history? She's healthy. You said she's happy.
So yeah, she's very happy child.
She's a talker.
Yeah.
That's good.
Yeah.
That's good. And so, I have a few other questions then to ask about just some of the things she does, or what she once did and what she does now. Was there ever a time that you thought there was a color that she really was attracted to?
Like orange was like.
Can you remember the first thing she ever looked at other than the light? Or one of the first things? Sorry, I'm bumping into you here.
No, I know we did a lot of like light up toys, just things you would buy for babies. And that was one of her things. She would always mash the lights, rather than play with anything else on the saucer. That was the lights was her favorite thing to do.
Okay. So her favorite early toys were light up toys.
Oh yeah, the shape sorters she didn't want any part of, because she would have to actually.
That's a pretty hard visual thing.
Right.
Yes. So today, do you think there's a color, or is color helpful to her? Does she notice things more that have bright color, or does it matter?
Bright colors. She does green and pink. She doesn't like gray at all.
Okay.
She says gray makes her nervous. I don't know where that comes from.
I love that. I've never heard that.
I don't know. Gray makes her nervous.
That is classic.
So
I have to write that down. Gray makes me nervous. Okay. So she sounds like just a wonderful child. All right. And so then she was looking past your face, not at your face. Did she notice things like the TV being on? Did she, because it has light or something, and color and movement, did she notice that kind of a thing?
She would. That was one of the, the things that her father and I both noticed, and then her aunts, and so she was like, "Do you think she's really seeing me?" Because she heard the voice, she would turn towards where the voice was coming from, but she would never look directly at you.
Okay.
She was always like either above or to the side.
To this day, now, is she still doing that same
Yes.
thing? Okay. All right.
Yeah, and she has to be like right here with most everything.
Okay, so her distance is really within about 10 inches of her face, you'd
Yeah.
say, or even closer.
Right.
All right. And has she, if you wanted to offer something to Holly and you kind of were offering it to her to take a look at, is there any position you would use? Would you hold the object in any special place?
Holly smells everything.
Does
It
she?
does not matter if it's food or
Uh-huh.
crayons, or she will smell.
Okay.
Because, I mean, she brings it up close and she smells it and then she looks at it.
Okay.
Um,
And is it better if you hold things at the right, the left, the center, up, down?
Up, like within eye level of her.
Okay.
She doesn't like, if she's, like, say I make her plate, if I put mashed potatoes on a white plate,
Uh-huh.
she just,
Yeah.
it bothers her.
Uh-huh.
She'll say, "Where's my plate?"
Does it make her nervous?
She just tells Mom, you know not to do that. Okay.
Yeah, I just gotta love it how they just take your inventory all the time. That's kids. So what do you do to help her? I mean, do you find yourself making adaptations?
I
to
do.
her?
Can
you
and
talk about that
without
a little
even thinking about it,
Yes.
she has a bright pink plate on because there's not too many foods that are pink,
Right.
and she uses that, and she does better with a bowl if you can put anything in a bowl
And
rather
is
than
the-
on a plate.
Bowl also a bright color?
Yeah, usually reds. We use a lot of reds at the house.
And why do you use red and pink?
I like red. She likes red.
Okay. Do you think
No.
it does anything in terms of her attention, or not so much?
I don't know.
Like, would blue or green be just as good as pink and red?
I would say green more than blue.
Okay. And is there anything better than green and blue? Are pink and red better?
Nah,
You think the key is bright?
bright.
Bright.
Yeah.
Okay. So
And
that's
just
the
a
key.
lot of this, we've done without even thinking about it.
Yes. Well,
Yeah.
actually, I've found that parents are so smart about following their child's lead,
Mhm.
and you really have to give yourself more credit because what you've done is you've figured out what works for her,
Right.
and that's not an accident. That's because you're really on it. You're
Mhm.
really noticing what helps her. So I think that's wonderful. So TV is not of any interest to her, or is it?
She watches TV.
Mhm.
She wants to be really close. I mean, we have a 47-inch television, and she still wants, in standing distance from it.
Okay. And what does she like on TV?
Oh, definitely Nick Jr. The Octonauts, the Backyardigans, the
She likes stories, things that have
stories. Right.
All right. She sounds really interesting. And so, if you had something of Holly's that she's had for a long time, an object, a toy, some
Mhm.
object, and you had something brand new she had never seen before, which thing do you think she would notice or be more interested in? The familiar thing
Oh,
or
definitely.
the brand new thing?
Definitely.
Definitely the
Yeah.
familiar thing.
Someone brought her a doll once. It's a stuffed doll of a
Uh-huh.
TV character that was on, and it was 3-dimensional, and she hated it. She said, "Get it out of here. I don't like it. Take it away."
Wow.
And I think because it was Alf. If you ever remember
Of
Alf,
course,
the
of course,
character,
yes.
and
Used to eat cat food, I
yeah.
believe. That's good, yes.
and she didn't like that at all. And that was one thing I thought. But he looks like, one of the characters you would see on Nick Jr. because she was way too young to know who Alf was.
Sure,
of course.
sure.
But she said just his face comes way out here and I don't like it. So
Interesting.
All of, like her bears, of course, she has one bear that has just stitches for eyes. It didn't, is one from an infant. That's one of her favorite toys.
So
it's a
she's,
shape more than a.
So she seems to kind of, if I understand correctly, she has favorites and she likes to go back to those favorites more than, and something new. Does it take her a while to get used to what it is?
Yes,
Okay.
she her favorite toy was Lego blocks. She had the big oversized Lego blocks, and she would play with those above and beyond anything else ever offered to play with her.
Interesting. Good. And they're bright. And
the red, the
once
blue,
you put them
the
together,
green.
they stay together.
Right.
That's a nice thing.
Yeah, because we had tried the, they make blocks that have ends on them and you pop them together. Didn't
Not
want
so
no part
much.
of that. Not so much of that.
Okay. What about books? You told us a little bit about how she couldn't identify the picture of these things, but she could identify the object.
Right.
What about books now?
Well, when she started reading, what I did was, depending on the size of the book, whether it be a large, we would use a full sheet of cardstock or we'd use a little, and I would cut the center out and I would just move it along so all she was seeing was the one word that I wanted her
Who
to
told
work
you
on.
to do that?
I've seen it somewhere online on Pinterest, I think, or
That's a very, very
so
excellent
everything
adaptation.
else was,
Excellent
and
adaptation.
then, we just, as she got better, we just increased that square, and then she was seeing more and more.
I should be able to give you college credit for this. You understand? This is really, really good. That's perfect.
It was quite helpful with her learning to read.
I bet. Tell me about her learning to read. How did that all come down? Did she do exactly what the other kids did, or
No.
she did some other things? Tell us about that.
She still has a very difficult time with letters that are made. If you print an A, just with the line up and the line across, she's fine. But if you see most of the time an A in print, it's like the circle with the curled A.
Yes.
She doesn't like to read letters that have a lot of lines in them. Like if like and is one, because you have to see the A and you have to see the N, and then another circle for D.
So is it that once she learns what a letter looks like, the variation to that letter throws
her off.
Exactly.
And
just like the toys, the things that are familiar she's got, but when you change it up or it's new, it's hard for her to figure out. Probably the same thing's true of the word. And does she read near grade level, or is she below grade level?
She's somewhat below grade level. One of the things that she did when she was small, and she has still doing it with her reading, but when she was small, like I'm saying infant, if you would set something to her left side, she would take her right side and pick it up. But she would never bring if you would take that same object and set it on her right side, she'd pick it up with her right hand. She never crossed her body with her left hand. She would, turn to do this. So when she started writing, she would write with her left hand, midline, then she'd write with her right hand.
She'd switch hands.
Yeah, she'd switch hands. So when she's reading now, she'll look at the book, and then she'll move it over, and she'll look at the book.
Show me that again.
She'll be looking at the book, and if we're reading a book, and then when we go to turn the page, we go like this. She moves the book.
Okay.
So it's always to that side.
Okay, so she positions her materials to her left.
Yes.
Okay. Does she ever use a slant board, or?
She has a slant board. She uses a magnifier dome. Yeah, because we have found anything
what does she
you
do
can.
with the magnifier? Does she use it all the time?
At school. She uses one at school. She doesn't have one at home. But yeah, we have found anything that you can, bring up rather than lay flat, she does better with.
All right. What happens when Holly's in a new place she's never been before? Visually, how does she behave? So if you take her into a brand new place, you're going, you would go to, I don't know, a new shopping area, or you're in a new movie theater, or you're someplace she's never been before.
She would stay right close.
Uh-huh.
She's never been one of these to like wide-eye gaze around. Because she squints at everything, even with her glasses on. She squints and she'll notice things that it's
Mostly
very
close or
difficult. Yeah,
What
close.
helps her notice things? Is it if she sees noise?
Noise.
Okay.
She will know, like with the voices. She knows your voice, but she can't find you in a room. If you were standing to that back wall, she would be like looking all over because she knows you're in the room, but she can't focus on your voice.
Does anything capture her attention, like movement or color, or does you ever notice her noticing something that's moving past her, or anything like that?
It would have to be within this area.
Okay.
Because if it was on the floor, it wouldn't matter. If it was up here, it wouldn't matter.
Okay. All right. What about so her upper field may also be an issue, huh? What about when Holly does respond to something? If you offer something to Holly, do you feel like sometimes, do you feel like she always just knows it's right there? Does it take a little bit of warm-up time? Is there a delay between the time you present it and the time she notices it? Is it just automatic? I mean, do you ever see that?
The majority of the time, you have to tell her, Holly, here it is. Because if we were talking and I would hand you this bottle of water, she wouldn't even recognize it was there.
What if you did this?
If I said, Holly, here's some water.
Okay. And what if you moved the bottle of water and didn't say a word? Would she catch it?
The noise, yes.
The noise.
Definitely.
What if it didn't make any noise and you moved it? Would she, let's say it's an empty bottle with a light in it and it's moved. Would she maybe catch it?
I would say you would have to have it here for her to actually see it.
Could it be here as well? Or you put it on my right side, could it also be on
I'm backwards from me. Yeah.
So
most everything is to the left that she sees. Like if I would hold it, right in front of her face, she still has her head turned. Now you'll say Holly. I mean, like a lot of this is so everyday to us
that
now
you can't almost define it, right? Yeah.
Right.
But it sounds like we're getting a pattern that things at her left are easier for her, and that she's not always seeing it before she's using some other information to get it. Okay.
She definitely, her hearing is remarkable to me. I mean, she can hear things, and she'll like, sirens or that are in a distance before I hear them.
Okay. It doesn't allow you to get away with much, huh? You can't sneak around. So what are her biggest challenges in school, do you think, in terms of her learning?
Her handwriting.
Okay.
I don't know that a lot of that is physical, because when she writes, she doesn't define the paper. We use white paper with very bold black lines when she's writing. She'll start out on the line, like her name is Hollie. You'll do the H and the O, and then it'll go way up here. It'll go way down here. She'll either want to write her name very far apart or right on top of each letter. Okay.
Keyboarding, is she using a computer at all?
She has some keyboarding skills, but it's getting her fingers on the home keys she's having troubles with.
How about friendships?
Yeah, she's a social butterfly, yes. Yeah, that's what they call her at school, the social butterfly.
So you're not concerned about that, about friendships
No.
and relationships.
Not at
How does
this
she
time.
do with faces and still be able to be social? How do you think she's figured that out?
I think she hears your voice, and then I have seen her feel like a person's face. She either feels their face, or she'll feel their hair, or everybody pretty much in her little community world now says, Holly, it's so
good.
and
They announce
so.
themselves.
Do you, I go, I'm from church with you, or it's me from Scouts, and then she'll come closer and she sees, or she'll say, we were in a situation the other day, we were in a flower shop, and Holly said, you sound familiar to me, and the lady introduced herself, and she said, now I know why I know your voice, but she never said, oh, I see you are. And you think about little things like that, and I don't think I'll ever understand how she actually sees the world, because you say, Holly, do you see that tree right there at the end of the table? Yeah, I see it. Yeah.
And do you think sometimes her definition of "I see it" is different than
Oh,
your other
absolutely.
children's?
Absolutely,
Yes.
because I don't understand. She says, I see it just fine. Well, to her it is fine because she's always seen it that way.
Yes.
But now that she's so vocal, you can kind of pick up sometimes she's not saying what you want her to look at, or describing at all what's on the printed page.
Right. So, just to ask a little more detail about books. So, are books a pleasure thing for her, or something that she may like to be read to, or listen to stories? Is that correct?
She'll read too. She memorizes a lot.
Okay. So she
Yes.
is a smart cookie.
Yes.
And do you feel like she uses the pictures to help her understand the story, or mostly just the words?
She'll use the pictures as long as they're simple pictures.
Okay.
If you present her with the Where's Waldo book, or no, I don't want that book.
What if if it's a simple book but she's never seen it before? Would that be challenging for her? To see the pictures.
She'll pick out, say you have a story of Little Bear. She'll say, well, there's Little Bear's walking. Okay, what's he walking through the woods? Is he walking down the street? And she'll say, he's walking.
Got it. Okay.
Yeah.
All right. Perfect. That's perfect.
And you.
So, do you what are your hopes and dreams? Like, what are your long range plans, hopes, thoughts for Holly's future?
My long range goal for her would be, that she learns to adapt the world to her, because it's always changing. She's going to come across, people that aren't so nice to her, and she understands that. We've already dealt with that situation a couple times where she's got seriously hurt because she was trying to do, what the other kids were. And it's hard as a parent, holding them back because you want them to go and explore all this stuff. And being left out because she doesn't see well, and, can't run down the meadow with them and that kind of stuff. It is hard as a parent. But if she can learn, okay, but I can walk really fast and I can catch up with you, or there are kids like me. She went to a camp a couple weeks ago, and a good many of them that went with her was totally blind. And she was in her heaven, because she could see somewhat to where these other kids couldn't. So she was like Mother Goose and everybody.
Oh, interesting. So she has some leadership in her, doesn't she?
Yeah, definitely. Yeah, because things have to be on schedule for her. And if you have a delay or you want to do this before you do this, she'll let you know that's not the schedule.
If you could give a message to educators, if you had a chance to just tell all educators, past, present, and future, something about Holly, what would you want them to know?
That she's come a long way. And, you know, if you have a mother come in or a parent, not necessarily mother, father, grandmother, whomever's raising the child, and they're like, you know, we've worked with her, we've seen her kind of do this, so let me know if you see more of that in, you know, the school, whatever, because I think that's what brought Holly's diagnosis along, was so much of it just wasn't physical. There was something else going on in there that was like, you know, like we had talked about the book. You know, that just, I didn't have any information. The teacher hadn't seen it before.
Right.
So I'm saying stay with it and just find the answer, because she's overcome so much, you know. And the
So
more
don't
you
give
do
up
it,
on her. Just
no,
keep.
no, don't give up on her. And, you know, so if you've got a reminder, you know, Holly, use your fingers, because when she's like in the school, she uses her fingers to trail the wall. And she knows when a certain trim stops where she's at. She has a focal point in the room. She knows whether to turn left or right when she sees that focal point to go.
She is clever, isn't she?
So I'm like, you know, you have to make those adaptations.
Yes.
Because you want her to feel included as much as she can.
That's great. And is there anything you would want to communicate to the medical community? Is there anything that you wish you could say to the doctors and all the physicians?
I think they could put more information out there, you know, because it's not something that is heard of a lot. You say visual impairment. Well, you know, this particular vision impairment goes along with a processing skill, and it is hard to figure out, because you can't just put a pair of glasses on her and say, okay, now you're able to do this.
Right.
No.
Right. But she does wear glasses,
She
right?
does wear
and
glasses.
What are her glasses for?
For the farsighted.
Okay, so do you happen to remember what the number is, plus something, the correction?
No.
That's okay. She wears them every day. She likes them.
She wears them every day.
Okay, and then finally, I wanted to ask you what your thoughts are about, if you can think back to Holly's early days of using her vision and then today. Have you seen her vision change at all?
Yeah, it's gotten better, I think. But I've also seen her, you know, kind of adapt in her own way. I don't know how to explain. Like,
I think you have explained smell,
like
and touch,
she
and
smells
voice.
things. She knows to smell things. She does better in low light, not real low light, but like when the sun goes down in the evening. She does, you know, and that's her favorite time to go outside. Most kids, when it's bright and sunny and she wants to play outside, no, she's not. She doesn't like the dark. It's just got to be that one.
Like reduced light.
Reduced light, right?
Got it.
That's what she likes best.
Anything else you'd like to share with me about this daughter of yours? She sounds extraordinary.
She is.
I'm very impressed with what you've told me, and I think you must have done tremendous things for her. And I'm going to just take a leap and say the improvements you think you've seen in her across the board, you should take a lot of credit for. You and your family should take a lot of credit for, because it sounds to me like you have perfect instincts.
Well, we just, like I said, it's become an everyday thing. It's not a challenge for us. You know, as a family, we'll say, Holly, stop, you're at the end of the sidewalk, and not even second, you know, it's second nature to us.
It's what you do.
Yeah. Or, you know, you hold your hand out when you're going up the steps, or, you know, you switch her sides when she needs to use the handrail, and you're not even consciously thinking about it. It's like, because I know before, when I would see people with challenged children out in public, I'm thinking, that's got to be exhausting, you know, to do that every day. And it's not something You know, when it's your child, you're like,
Absolutely.
nature, you know,
Mhm.
just takes over. You do it. You don't think about it.
Mhm.
So,
Great.
I mean, just learn as much as you can and never tell them they can't.
Wonderful.